good morning to you. It's 7 p.m. out here in India.
Yeah, but it's 8:30 here.
All right.
I appreciate the time for the follow-up.
That's a weekday, yeah. Much like the attentive care given to a garden ensures a fruitful yield, ongoing post-transplant follow-ups ensure the best possible results for you. So this patient received a hair transplant, first hair transplant in the Dominican Republic 10 years back, followed 1 year later by a hair transplant procedure at Darling Buds Clinic, in which the FUT scar was repaired and the front hairline and part of the mid-scalp, the frontal region, was covered. And now we are 7 years after the procedure, and now he's here with me to discuss how he should take this further, because he can see thinning in the last few months, how he should best use finasteride, minoxidil, derma rolling that he's very fond of. So hang on and we'll discuss just that just now.
So let's get into it, right?
Yes, please tell me.
I'm in the bathroom. I'm giving you my best light, just because definitely density is not where I am. I've lost some hair. Not because I actually seen it, because of two problems. First, the gray hair is hard to see, but I've seen it when I sweep my floors, right? So I think that it actually happened when I switched from the finasteride that you gave me versus the finasteride that I received from my doctor.
Okay.
I sent you a picture on the other phone number. Do you want to see it now?
Yeah, I'll just have a look. You sent it just now, is it?
Not to this number, but to the other number.
Yeah, I'm seeing the other number now. When did you send it?
However, I do have it.
Yeah, you sent me this camber, the finasteride preparation. Yes.
Yeah. So what do you think? That could be a reason for shedding?
So when did you switch over to finasteride locally?
I switched to chamber right after I finished yours. That's gonna say probably 6 months ago, maybe 8 months ago.
So when did the shedding start?
Around the same time.
Around the same time.
But I also noticed that I started having some side effects from finasteride just at the same time. I was getting very few hours of sleep, and that get worse, right? So I had to really do the 3 month stop that you told me to.
Yeah.
Oh, no, it's not 3 months. It probably was 6 weeks, actually.
You stopped for 6 weeks.
It worked. It worked. The secondary effects, all gone. Everything went back to normal. Motivation to the gym went back. So I felt pretty normal. But when I came back to chamber. I don't know if I'm doing right or something wrong. Oh, the other thing, I really haven't been able to train less, because I'm trying to sustain the muscular level. I'm not really beefy, but I'm just letting you know that I used to be. You can see my body there.
Yeah, I saw it. Yeah, I saw it just now. Yeah.
I used to be a little bit more than this.
Mm-hmm.
But the reason I'm trying to train harder just to maintain the muscular level. But then I'm asking you, should I lower my intensity, my weightlifting, so I can do more cardio? All those three questions I have for you.
Yeah. Firstly, about the shedding. Yes, whenever you switch from one brand to the other, there is bound to be shedding, because there is a lot of polymorphism, that is variation from one brand to the other. So when your body adjusts from one brand to the other, there is bound to be shedding. As you can see, there is a little loss of density, but this will come back. This will come back.
It'll come back?
Because the hair have not gone, they've become thin. The transplanted hair are permanent. They will not fall off. They will just thin out when there is shedding when you switch brands. So these will come back, because all these are your transplanted hair which I have planted.
So should I stick to this brand?
Yeah, now that you started it, stick to this brand only. Don't switch again back to the same old brand. So switch to it, stick to it now. Don't change brands anymore. Okay, this is an okay brand. Don't switch over to any other brand. Keep going with this. Control your sleeping hours, and as far as your exercises go, you alternate anaerobic exercises, that is powerlifting, with aerobic exercises, which is cardio. Don't do powerlifting all the time. Alternate it.
Okay, so lower a little bit.
Yeah. So are you taking whey protein?
No, I stop all the supplements. I just take. I cannot even. I just take white eggs.
Okay, white. That's fine. That's fine.
So let me go back to my notes. I have some other questions.
Yeah, please. You're most welcome.
I'm going through it. Side effects from minoxidil.
Can you comb your hair and show me how it looks otherwise with properly groomed hair? Yeah. So minoxidil, topical minoxidil you were discussing.
No, I'm taking the pills.
Mm-hmm.
I gained weight for that reason, and I'm sure about it because I never been this fat.
Mm.
And two, I have to squint with my eyes most of the time. I never used to do that. Is that normal?
That's normal. You can't ascribe all this to finasteride or to minoxidil. So what minoxidil oral are you taking? 2.5 milligram?
2.5 daily.
2.5 milligram.
In the morning.
Fine.
It was too much for me at night. I was having problems also.
Fine. So any other questions?
Yeah. To restore the density, should I go back to 1 milligram or
how much are you?
leave it at
How much are you taking now? 0.5 milligram alternate days?
No, 0.5 every day.
Every
just
day.
to reach out again the density.
So what you do is go to 1 milligram for about 4 months, and then we'll discuss again.
Okay.
All right.
We pretty much cover everything. You said that density will go back?
Yeah, density will improve in 4 months' time.
Okay. I also am doing now the microneedling.
That's fine.
On top of the
what needle? What needle are you using? The size of the needle?
1.5. I'm doing the microneedle pen.
All right, 1 millimeter.
I bump it to 1.5. Is that okay?
That's fine. Only thing it'll cause more pain and more inflammation. But it's all right if you can tolerate it. If you can tolerate it, it's fine.
Okay, so I'm gonna lower it because yes, it was hard to tolerate. But I don't know. I think we cover everything.
All right. So we'll again discuss after 4 months how you're faring, how your hair has grown, and then we'll take it on from there.
Alrighty.
All right.
Thank you, doctor.
Okay. Bye bye. So thank you for watching. If you have any questions about this patient, any doubt in your mind about post-operative care, about the use of medications after hair transplant, do let me know and I'll be there to help you. Leave a comment in the comment section below and I'll reply back to you in 2 days. Have a nice day. Thank you for watching and God bless you.